excited to talk today about the CIPHER trial, which is just opened. Dr. Sanford is a member of the Department of Radiation Oncology, where she treats patients with gastrointestinal cancers, which include the pancreas, liver, bile ducts, colectorum, anus, esophagus, and stomach. And she's also very involved with multiple clinical trials besides CIPHER. But today we're going to focus on CIPHER and answer any questions you may have. As a reminder, this is a public forum, but we can't answer really specific questions due to patient privacy laws, but we're certainly going to take as many as we can get to. So let's go ahead and welcome Dr. Sanford. Thank you for joining us. This should be an interesting chat. So tell us, what are you testing in CIPHER?
Sure. So first, CIPHER is a randomized trial for patients with pancreatic cancer that is unresectable, so patients that cannot go to surgery, with non-metastatic cancer, so it has not spread to other parts of the body. And what we're testing in the trial is whether or not radiation therapy with carbon ions is more effective than radiation therapy with photons or x-rays.
And so who is a good candidate, just right off the bat?
Right. So the patient has to be diagnosed with pancreatic cancer. It has to be deemed inoperable by a surgeon. And based on staging scans, it cannot have spread to other parts of the body. So locally advanced unresectable pancreatic cancer.
Good to know. Great way to start off the chat. So you mentioned part of it is testing carbon. What is unique about using carbon for radiation?
Sure. So traditionally radiation is given with photons or x-rays. That is how the majority of patients receive radiation. Carbon potentially has several benefits over photons, both physiologically and biologically. So what that means is that carbon is able to pinpoint radiation dose more precisely than with photons. And it also has the potential to do more DNA damage, in part more DNA damage to cancer cells. So we are testing whether or not that translates into better tumor control and survival for patients.
Good to know. So when you were first describing the trial, you mentioned that it was randomized.
Yes.
What does that mean?
Sure. So randomized control trial is one in which the allocation to treatment is random. So it's determined by usually a computer algorithm. We say basically a coin flip study where patients are randomly allocated to either, in this case, to receive carbon or to receive photons. And it's really the best way to test whether or not a new treatment paradigm is superior to a standard, because it reduces biases in the two treatment arms, so that patients in one group or the other have similar baseline characteristics.
So in this trial, anybody who's enrolled and becomes part of it will receive some type of therapy.
Correct. So all patients will receive both chemotherapy and radiation. So the chemotherapy will be a standard regimen, usually a multi-agent chemotherapy regimen lasting about 4 months total. And then the radiation part is what's randomized. So patients will receive either radiation with carbon or with photons.
Good to know. So I see the questions are starting to come in. So great, definitely keep them coming. We're going to start with this first one here from Christy. And the question is, it's my understanding that pancreatic cancer is very hard to cure. Could this provide framework for a future cure?
Sure. So thanks, Christy, for your question. So you're right, pancreatic cancer is difficult to cure. The goal of the study is to see if carbon is more effective than photons. If we find that that is the case, then it could certainly lead to further investigations, whether or not going to a higher radiation dose, combining it with other chemotherapy agents, maybe even doing this treatment before attempting surgery. So lots of potential avenues this could go down in the future.
Great question. Thanks for joining us. So what exactly does the treatment entail, and how does it differ from what somebody would typically do to have therapy with photons?
Sure. So traditionally for patients with pancreatic cancer who do not go to surgery, almost all of them receive chemotherapy, and some of them receive radiation therapy as well. So in that sense, this is kind of matching the standard. And as I mentioned earlier, the chemotherapy given is a standard regimen. What's different about this is using the carbon for radiation.
Good to know. So how long is the treatment?
So the total treatment time, and that consists of the chemotherapy and radiation, will be about 4 to 6 months.
Okay.
So it's going to be 4 months of chemotherapy, either all given after the radiation or both before and after. And then the radiation part will last 3 weeks if it's carbon, and about 5 to 6 weeks if it's photons.
Okay, so the carbon therapy is shorter.
Is shorter, yes.
Okay, good to know. So what about, potential side effects? Are they similar to traditional treatment, or are they different?
Yeah, so for my patients getting radiation for pancreatic cancer, I'd say common side effects would be things like fatigue, maybe some nausea, some abdominal cramping, some diarrhea.
Okay.
Though to be honest, the majority of my patients tolerate this treatment pretty well. One of the things we're looking at in this trial is what side effects there are with carbon radiation.
Okay.
There have been studies on patients getting carbon radiation for pancreatic cancer, and the side effect profile has been actually very favorable, so very low risk of a severe side effect. Obviously, this is something we'll be monitoring very closely in the trial, both during treatment and after, but it's something that we are optimistic about based on prior studies, but something that we're seeking to learn more as well.
Great, good to know. Great questions that are coming in. So, there's been a lot of chatter, particularly among the research community, radiation oncology, and some others in kind of the PanCan community. What's the primary measure or outcome that you're measuring?
So the primary outcome is survival.
Okay.
Namely, survival at 2 years after diagnosis.
Okay. What is the traditional survival time?
So unfortunately, patients with unresectable pancreatic cancer, currently the prognosis is quite poor. I would say the median survival is on the range about a year or so after diagnosis.
Oh, wow. So 2 years is really doubling that.
Yes.
Okay. What about secondary outcomes? Are you looking for anything else?
Sure. So a variety of secondary outcomes. One is progression-free survival, so surviving without your tumor progressing. We're looking at quality of life, so how well patients live. Not only are they living, treatment side effects, and rate of the tumor spreading to other parts of the body as well.
Okay, great, good to know. So how many, I know this obviously takes place over multiple continents. Tell us a little bit about that part. So somebody would, if a participant, they would have chemotherapy here, and then would they travel for the second part of the trial?
Yes. So first, as you mentioned, this is a large international effort. We are the coordinating site, and our partners are in Japan and in Italy.
Okay.
So for patients coming out of the U.S., they'll have their chemotherapy at home.
Okay.
And then if they're randomized to carbon, they will travel to Japan for the duration of radiation and a week of planning. That's a total of 4 weeks. And then if they're randomized to photons, they'll get treatment here.
Okay. So what does that entail going to Japan? Are they out of pocket any expenses? How does that work?
Right. So the short answer is no.
Okay.
So the trial will cover all costs of going to Japan and treatment in Japan. So flight, housing, transportation, there's a food stipend. The people who have worked on this trial have really thought meticulously about every detail as far as we can foresee.
Right.
Even having an interpreter meet the patient at the airport. So the short answer is cost to Japan will be completely covered by the trial.
Okay.
If the patient is randomized to the photon arm, then we will not cover costs, but the treatment is expected to be covered by the patient's insurance.
Okay, good to know. So if somebody was randomized to photon but wanted to do the carbon anyway, is that an option where somebody could do that, or not really?
That's not an option, unfortunately. Yeah.
So it's only through the clinical trial?
It's through the clinical trial, yeah.
Okay, good to know. So how many people are you looking for?
So our target accrual is just around 100 patients.
Okay. How many more? You just started, so
we just started. We have yet to enroll our first patient. We're actively screening our clinics here, and we are looking forward to enrolling that patient hopefully sometime soon.
That's exciting. So what does that screening look like? Have you told kind of all of the radiation oncologists this is what they're looking for, and they send patients? Do you go in and meet the patients? Kind of what happens there?
So a combination of both. So we've certainly tried to let our colleagues at the institution and at other institutions know about the trial, and we're basically looking at patients that are coming through our clinic.
Okay.
And seeing if they meet the criteria for inclusion into the clinical trial.
Okay, good to know. So how long are participants, if they are randomized to the carbon part of the trial, how long would they be in Japan for?
Yeah, so a total of 4 weeks. So they
Okay.
basically fly there. A couple of days later, they would get the radiation planning. Radiation would start a few weeks after.
Okay.
It's 3 weeks of treatment, and then they would fly home after. So a total of 4 weeks. And I should add that the trial supports taking a caregiver with them to Japan, so they're not alone for that time.
That's good to know. So we're getting some more questions and about some more specifics about the trial. Here's one. Is there an age limit for trial participation?
That is a good question. I will double check and get back to you on that.
Okay.
There's certainly a health status limit.
Okay.
So you have to be a reasonable overall health status and certainly able to travel abroad. But let me get back to you on the exact age limit.
Okay. And I know that pancreatic cancer is rare in children, but would somebody under 18 be eligible?
No, this would only be for adults.
Okay, good to know. Well, so in the grand scheme of things, why is this trial important?
Sure. So as we had talked about earlier, prognosis for these patients remains poor. There has been a lot of research both in the lab and in the clinic over the past several decades on how to improve outcomes for these patients.
Okay.
But their prognosis has largely been stagnant, so as we had mentioned, about a year after diagnosis. So we are seeking to use a novel form of radiation therapy to hopefully dramatically improve outcomes while helping them maintain a quality of life. So we're excited about that.
Absolutely. It sounds like a wonderful and incredible opportunity here. So what is your message to individuals that are watching? How can they get involved? How can they help? Is there any way possible?
Sure. So if you have any questions about the trial, I guess one way is to reach out through Facebook, but we also have a trial website, which I think we should be able to provide.
Absolutely.
So the principal investigator, the overall leader of the trial is Dr. David Scher. He's a radiation oncologist here. The coordinator of the trial, her name is Sarah Hardy. We have a website where patients can contact us and ask questions and ask about eligibility. So that's probably the best way to both find out more about the trial and to reach out to us directly.
Okay, and we will definitely, if we haven't already, we will share that contact information as well as the website in the comments. So please share that with anybody you know. Hopefully, we definitely want to get the word out. We want to try to find 100 people. So with that 100 number, is that, I assume that's nationwide, so they don't all have to come from the Dallas area.
It's worldwide 100. So here, Japan, and Italy, 100 total.
Okay, so we've got time for maybe one or two more questions. We've got one here from Ellen, and her question is there any life alteration that patients and their family need to make while participating in this trial?
Can you clarify what you mean?
I think, do they need to make any lifestyle changes, anything day to day, maybe, I assume obviously you have to have a passport, that sort of thing, but is there anything else you could think of?
So logistic wise, we're hoping to make this as easy and as convenient as possible for patients. So for the traveling to Japan part, we will handle all of those things.
Okay.
In terms of general lifestyle and day-to-day changes, just sort of maintaining a healthy lifestyle and nutrition, exercise, just kind of general advice to maximize your health, I would say. Okay,
good to know. Thanks for asking, Ellen. Thanks for joining. So there's one other question here, and this one comes in that we touched on briefly at the beginning, but have there been any similar studies completed elsewhere, and was there an improvement in patient outcomes?
Great question. So before we embark on a large randomized trial, we usually do smaller studies testing not only the efficacy but the side effects. So there have been small studies using really just carbon, not randomized between carbon and photons, out of different centers, including out of the center that we're partnering with in Japan, that have shown promising outcomes for patients who fit the trial criteria for our trial. So we are basing our trial premise and our goals of the trial based on these smaller prior studies.
Good to know. Great question. We're so glad you joined us. We are running out of time here, but I want to ask one more question before we go and then let you get back to your day. For people that may see this later or may come months from now, what's your message about the trial? What should people remember?
See if I can encapsulate that. This is a very exciting trial. We're very optimistic about it. We understand that there are challenges in terms of a lot of sacrifice from the patient end, both traveling abroad and both entrusting themselves or a family member into a clinical trial. But we greatly value our patients who participate in clinical trials, and we're hopeful that this will lead the way to improving outcomes in patients with pancreatic cancer.
I think that's perfect. That's just what we needed. So we're going to go ahead and wrap up the chat. I want to thank everybody for all of the great questions and for participating. As always, this will be on our YouTube channel later today, but it'll still be here on Facebook if you want to refer to it later or share it with friends. In the meantime, though, thank you so much for your time, Dr. Sanford. This was very enlightening, and hopefully we'll get some patients headed your way.
Thank you very much.
All right, have a great day.